SSRIs, this theory validates the use of SSRIs. And if you're looking back at 50 years of the research saying, hey, this theory makes no sense, it doesn't have any scientific validation, but you have a very large industry that needs it to be validated in order to sell something.
Yes.
Do you think that was one of the main influences that really got people to buy into something that has no evidence behind it? The big pharma's influence, right?
Absolutely. I mean, the marketing, but also not just the marketing, but even what gets published and what doesn't get published. Right. So all the people in charge of, all the gatekeepers involved there. But absolutely, money is always money.
Always
power.
follow the money trail, right?
It always takes you back to what's going on. Yeah.
So now that this is out there, you're saying that many psychiatrists aren't even really responding to this. I mean, I saw it get picked up. It wasn't like something I was actively looking for. It was on the front page of some news place. Someone sent it to me. It was, published on Instagram by many people.
Yeah.
Do you feel like this may change something in how we approach depression? Maybe not in the short term with psychiatrists right now saying, oh, but maybe more things will follow to say, all right, let's keep going and dig into this more. Do you feel like that will change the use of, let's say, SSRIs and antidepressants?
Well, the history of psychiatry, if it follows the history of psychiatry, we're just going to find another drug with another explanation. And I think we already have. I mean, I think what we're moving towards are sort of the psychedelics, which we've been to before, but I think we're coming back to them. But again, right, they have some value and they certainly help some people, as do some antidepressants. I mean, they found that it's about 15%, has a 15% greater chance of being effective than a placebo, which is a really, really small chance. But there are 15% of people that are benefiting. It's a really small number. But again, it'll be the same so we can roll out the ketamine and the mushrooms and they can have an effect for sure, but there's also a real danger, especially in our society, with pharmaceutical companies are so going to control it, and it's going to become handed out to everyone, quick fix, and that's just not how it works. So my fear is it'll just be replaced with something else that may even have bigger consequences now than it'll be just like the opioid epidemic, right? It'll just be overprescribed, and then there'll be all kinds of outcomes from that. That's my fear. Right. My hope is that that's not the case and that things will change, but I haven't seen that happen yet. But maybe it will.
I think it's a small movement that's going on, right, in this understanding of holistic psychiatry, of other things, the lifestyle changes, responsibility under addressing root causes of depression.